Hey, it's Greyson here again. Thought I'd make another Amberlynn Reid video. Got an alert a little bit ago about her torrid clothing haul. Got to see a little bit of that. She certainly seems to get herself a lot of clothes for somebody who's overweight or severely obese. Honestly, for me, I'm like I guess I'd say afraid sometimes to even shop for clothing if I've even gained a little bit of weight. But she just keeps getting hauls and hauls, literally, of clothing, which obviously we can go into her financial decision-making, the kind of decision-making and her logic and the way she thinks through things in a different video, and how, honestly, some of it I can honestly see myself in a lot of her behaviors. I have a mental health issue. I'm not obese right now. I'm not overweight right now. I had a bit of a weight problem when I was younger, like before 12 years old. But I can see some of her thinking in my thinking, let's put it that way. But what I wanted to come to you today about was this whole idea that I've been seeing in response videos and comment section being sent to Amberlynn DMs that she should go to a residential treatment center, which probably is something that should be done. Have to give my disclaimer right now. If you're watching this and you have medical issues, or if you are dealing with any issue requiring professional advice, nothing I say replaces professional advice. Before acting on anything that you may have understood from any of my content, you should consult an independent and qualified professional in your area. And if you need access to medical care that is at a lower cost or free, depending on your income, you can call 211 from any phone in the United States. So this whole idea that Amberlynn should go to inpatient treatment, honestly, it makes sense intuitively, but on a practical level, it's different. First thing you want to look at is you want to look at somebody's level of means. You want to look at their level of, as we would call it in the policy world, agency. You want to look at how much agency does Amberlynn have. And that's frankly defined in dollars when it comes to the healthcare system in America. Let's just be honest. So I've heard estimates for income between $5,000 and $12,000. At either of those income levels, those are pretty high levels of income. She does say that she doesn't have health insurance, which her doctors told her she needs to get health insurance. It appears that she knows it's important, but she didn't do it, which possibly denial. I can see, in my own decision-making, I personally am pretty judicious about making sure that I'm always covered. Even with my condition, which isn't as serious as Amberlynn's, I'm pretty judicious about that kind of stuff. But I can see how somebody would want to swipe it kind of by the wayside and not think about it, because the less you think about it, the less emotional distress you could have. But we'll probably go into her mindset in a totally different video. But that aside, $5,000 to $12,000 of income, no insurance. It's possible those income estimates could be overinflated. It could be variable. YouTube income is rather precarious. It's not like you get a salary. It's not like a TV network deal or something like that. But at that income level, she probably has enough money to save up. And where would she go at that point? If she wanted to get treatment at a medical facility, it appears she would have basically two choices. She'd have private facility or a actual hospital. Private facilities, from what I've seen, some of them don't post prices. A lot of them seem like they're more of addiction centers, and a lot of them will be far from her home. Like, I just looked it up in Kentucky. There are maybe a few facilities that seem like they're more addiction-focused type treatment centers. And then it was showing me ones out of state in Tennessee, Florida. It even showed me something in my neck of the woods out here in Costa Mesa, California. So it may not be that those resources are available locally. The one place I did find that had pricing was like $3,865 a week, which is pretty high, and that's out in North Carolina. So yeah, that would wipe out even the high estimates of her income. But she could probably save up enough at either of those income levels. She's in a part of the country with a lower cost of living. Honestly, $5,000 a month, I'd be doing very well living in Southern California, just being on my own. Thankfully, I get supported by my mother. I'm embarrassed to tell you guys that, but I am. I live in her home rent-free, thank God. But it's painful for me to admit this. Told you, cognitive dissonance, it's a thing. Yeah, she lives in a lower cost of living area, so she could probably save up. Her spending decisions, obviously, people question those. Could be emotional stuff too, same root as her eating stuff. But she could maybe afford a couple weeks or so just from saving up money, depending upon her income level. If her income level is a lot lower, then she could probably qualify for a variety of assistance programs. Typically 300% of federal poverty level seems to be the threshold for the hospitals. And then for like Medicaid, it's like 138% of federal poverty level is probably between $1,300 per month in income to about $3,000 per month in income, if I'm doing all the math right. But even if she was insured, the programs that will be available under insurance would probably be the hospital ones. And a lot of the ones, like, there was only like one hospital one I could find in her state, and it was basically saying that they do outpatient weight loss, and if you're over 100 pounds, I guess they steer you into their surgery program. So an inpatient treatment covered by insurance or available under a financial assistance program is probably going to be pretty untenable. And if she tries to, like, quote unquote, just go and check herself in, which is a notion that I've heard, it's not like she can just walk in. And for any sort of mental health diagnosis, even if those are something that's serious, if you just try to check yourself in at a hospital, you wind up in the ER, and then you wind up getting sent home in many cases, especially if you don't have insurance. So the whole notion of her checking herself in directly is going to be an issue. If she has that $5,000 to $12,000 a month worth of income, she could save up enough money to go to a facility, a private inpatient facility, but she'd have to find a way to get to a place that's possibly out of state. As far as things that will be at a hospital, then that would require a variety of medical intervention. That's going to be way, way more expensive. Hospital charge masters for uninsured people are notoriously high, and if she's on some sort of financial assistance program, they're probably going to try to kick her out pretty quickly, because that's a loss, obviously, to the institution. And it's very tough. Binge eating disorder it's technically a mental health issue, but there's a whole stigma and stereotype around weight in particular that's greater than even like a regular mental health issue. They're like, okay, you can just go on a diet, you can just lose weight, or if you really need it, go weight loss surgery, which is covered by some insurances, isn't covered by some insurances. And there aren't a lot of like dedicated facilities like that. There are like fat camp, things like that. There are more informal places where I wouldn't want to send her in her situation. The other option she has for like 24-hour supervision are some of the more ad hoc type options. And these are probably less acceptable and be suboptimal. And in any event, she should be really being medically supervised, whether it's outpatient, inpatient, or whatever. And her first step really should be, I don't know if it should be to get insurance, get under some sort of plan where she's able to cover a good deal of these expenses, and then get to a doctor, and then get their lead from there. And I don't know about this doctor that she says that she goes to. I don't know anything about him. We don't know much about it. There's a lot of questions around that, and it's hard to speculate, but that would be like to go somebody that actually knows what they're doing with weight loss. A weight loss specialist outpatient will probably be easier to do than just show up and try to get admitted inpatient either through the ER or showing up to one of these private facilities. It will be a lot easier of an option and is absolutely still necessary. But in her case, like, there have been suggestions of like more ad hoc type interventions where it's like somebody saying, oh, you can come and move in with me. Obviously, safety, security, those things are issues. I've heard of arrangements where people will have somebody come in and live with them, like for addiction treatment. There are there are cases where somebody will go to addiction treatment outpatient, and then they're like accountability people that'll like live with them, stay with them. You tend to hear about this a lot of like when celebrities are traveling. Obviously that stuff's super expensive. There are people that have supposedly offered her to do stuff for free through social media. Obviously anything that just comes through the internet, take with a grain of salt, but if she has no other choice and she just keeps eating and eating and eating and getting herself further and further and further, I honestly, I'd be tempted to, okay, this person might be able to just come and be sort of serve as accountability while I go to something where it's more outpatient during the day, or go for accountability Overeaters Anonymous meetings or something else I've heard thrown around, which those, as far as I'm aware, they're like Alcoholics Anonymous meetings, so they'd be free. So if she really didn't have the resources, she couldn't qualify for financial assistance, for hospital care, she couldn't qualify for credit. Honestly, I don't like the fact that I'm in credit card debt, but this is the kind of thing that is a good idea to go into credit card debt for. If she has enough income and her FICO score is good enough, this kind of thing you should go into credit card debt for. But then she kind of, none of those options were available, all those options were foreclosed, that option of just going and taking somebody up on their offer to have accountability like in your own home, or going or possibly living with somebody just to get into a more positive peer environment than where she is right now, and then aggressively seeking whatever is available on an outpatient basis. Good news for her is that regardless of what's going on, it seems like she has an income source that it's blessing and a curse that's YouTube, that's her income source. But it's more flexible than if she had to show up to some sort of 9-to-5 job. That she has going for her in a way, but it could also be going against her. And that's why it's important for her to get good medical opinions, because for all we know, she might talk to some sort of mental health specialist or a weight loss specialist who tells her, no, you can't be doing this YouTube channel thing anymore. It's destructive to your health. But you can't just like quit those kinds of things and go on assistance without getting medical advice telling you to do so, or at least it's harder if she wanted to seek any sort of public assistance, especially in Kentucky, which is a more conservative state. Now, that was a mouthful, a little bit disorganized, but hopefully that gives you a little bit of insight into the whole situation of if Amberlynn Reid wanted to check herself in for treatment, what she would be going through. Watch out for a separate video on her behavioral situations, and God help Amberlynn Reid.